6-year-old with a history of cancer who has been having difficulty walking and lower extremity weakness for the past 2 days. There is no history of trauma.
All right, you have your scenario. Let's go. Grab your cheat sheets. Always remember, red goes to the head and head to the heel. In this case, you can see this little one is in zone. Now to Scott for your quick tip.
So when you've got a little kid with some sort of a hem-onc diagnosis, otherwise known as they have something that's got an emia or an oma at the end of it, that can't be good. And when you talk to hem-onc nurses, they'll remind you that there's 90 gazillion bad things that could happen. However, for most of us, outside of inpatient hem-onc, that's too much to remember. And they'll remind us that most times in pre-hospital or in the ER, we only tend to come across 4. You can have neutropenic fever, superior vena cava syndrome, tumor lysis syndrome, or in this case, spinal cord compression. And happily, spinal cord compression we don't see very often because inpatient hem-onc is really good about teaching mom, dad, and the kid about what to look for. And why that is absolutely crucial is simple. To no surprise, the faster you treat it, the better they do. So if a kid comes in walking and talking, chances are, you know what, they're probably going to be discharged walking and talking. But if they wait to come in until now they have bowel, bladder, or the ability to walk, chances are how would they discharge is the same way. So when it comes to spinal cord compression, absolutely history and physical. And this is actually, if you have the capabilities, one of the few instances that yes, even at 3 o'clock in the morning, we actually call MRI in at 3 o'clock in the morning to do an MRI. And they absolutely are going to get Decadron or some sort of steroid to help the swelling. But when you're dealing with spinal cord compression, the moral of the story is simple. The sooner you treat it, the better they're going to do. If you come in walking and talking, chances are you'll be discharged walking and talking. If you come in having lost something, regrettably, in a fair amount of cases, they're discharged the same way.